And as I said before, the aim of these two meetings is not to give a comprehensive picture about these two topics because they are huge and there are many ramifications for these two topics. But my aim is to present something for you so you can dig deep and investigate more about these two things. And I am glad to hear that you have started the service for adult congenital heart disease in your hospital. And you cannot do this without computers, without artificial intelligence. Artificial intelligence is the capability of computers to respond in a matter resembling human intelligence. This is the aim, is to try for the computer to try to behave like human, which I think is very, very difficult. But having said that, computers can predict and can recommend and can even take decisions to influence our lives, whether it's virtual or real environment. Artificial intelligence, like anything else in life, it has got its bads, its pros and cons, advantages and disadvantages. But the benefits are vast and profound. With artificial intelligence, you can unlock secrets of universe. You can you can unlock the secrets of diseases. You can develop a new drug. You can improve diagnosis. And developing drugs and diagnosis, you can, while developing new drugs, you can develop something else which could be harmful. So you have to control things so you make the most of it without causing a harm. AI can transform agriculture with having new crops that could live longer and they don't rot quickly. And putting this all together, this will create a healthier and more sustainable world. With AI, scientists hope to simulate everything from human organs to the planet itself. They are these human organs, and they are almost close to, to human nature to the extent that they are called digital twins. But the dangers or the drawbacks that we may be at the mercy of a machine or a robot. And whilst you are playing with the building block like genes, DNA, RNA, to help people, to help patients to fight disease, you can create also unintended pathogens or virus or bacteria, which may be harmful. So AI is important to fight disease, but you may create something that will cause damage to the human beings. So we are really in a turning point here. Mustafa Suleiman wrote a book about artificial intelligence called The Coming Wave. Mustafa Suleiman is a key and you considered a leader in AI. He described AI as a new wave. but he compared it with the past waves like discovery of fire, invention of wheel, and harnessing electricity. At that time, these were considered important waves, and they have changed the civilization. But the coming wave, which is the recent AI, it is the future for all of us. They have its dangers and as well as wonders. There are benefits and risks, with good potential and disasters on the way. This is just some definition of artificial intelligence. I will not bother you with this, except artificial intelligence is a science of teaching machines to learn human-like capabilities. And this is based on a technique called deep learning. The example of deep learning is Chat GPT. For myself, the first time to know Chat GPT was from my niece about a year ago. She was asking me, "Can you help me with Chat GPT?" I said, I had no idea about it. And she started talking about Chat GPT, and I just kept quiet and silent because I am not up to it. It's something beyond me. I suppose I'm getting old, or I am old, and she's still young. So, so Mustafa Solomon describes AI as a coming wave. To me, it's not a coming wave. It's not a small wave. It's a tsunami. It's a big wave, and it could drown us if we don't control it properly. This picture shows you four people that they have changed the world. Mustafa, the top two, Mustafa Solomon and Steve Jobs. Steve Jobs, this is the CEO of Apple Computer. And I was surprised to know that Steve Jobs, he is Syrian in origin. His father is called Abdel Fattah, but he got his Steve Jobs name from the adopted family. So Mustafa Solomon and Steve Jobs, they are Syrians. But Steve Jobs, he died in his 50s because of pancreatic cancer. And Mustafa Solomon, he lives in California. The lower two, the one on the right is Bill Gates, the Microsoft guy, and the one on the left is Elon Musk. Elon Musk is South African and he lives in California, or he lives in the state. I'm not sure whether he lives in California in another place. But these four people, in spite of fact they are not politicians, but they have changed the world with their pioneering work. Steve Jobs with his smartphone, where all of us were using it, and Mustafa Solomon with AI work. Just a word about Elon Musk because he is the CEO of SpaceX. SpaceX, from its name, it's something to do with the space. And also they have produced the Tesla car, which is electric car. You can see it in the UK everywhere. And NASA, with all its might, they go to him to rescue the astronaut they are stuck in the International Space Station because, in spite of fact, NASA is a government, US government organization, but they go to Elon Musk to help them bringing the astronaut back to Earth. Because Elon Musk has got advantage over NASA that his rockets, they can be reused. while the rockets of NASA, they can be used just once. So anyhow, these four people, they are not politicians, but they managed to change the world with their work. To give you an idea about how important is the artificial intelligence, in September issue of the Time magazine in the States, the cover of it showed the important people in the field of artificial intelligence. And when I looked at the cover, I was surprised and happy to see the one in the middle here with the sorry.
I was happy to see Scarlett Johansson. It's an
I couldn't hear you, but what I want to say that I was surprised and happy to see the man in the middle with his Arab dress. And his name is Omar Al-Ulama. He is the Minister of Artificial Intelligence in UAE, the first country to have artificial intelligence minister was UAE. He was appointed 2017. And countries like US and the European community, European Union and China, yet to have to appoint people like Omar Al-Ulama as Minister for Artificial Intelligence. So it's something we have to say a big plus for United Arab Emirates. This one of the important people in AI. I meant to delete this, but it happened that they are still there. AI was first introduced in 1955 by John McCarthy. And he said that it is the science and engineering of making intelligent machines. And just The Economist, which is a respectable magazine in UK, in August this year, it said that AI can be described as the art of getting computers to do things that are or that seems smart, clever to humans. The government in the UK is trying to make the most of the artificial intelligence and the high-tech companies for the benefit of the NHS. NHS means National Health Service. It equals the Ministry of Health in Egypt. To begin with, they formed the NH Digital, and then in 23, they merged it with NHSX. These two bodies, they become one body, and the long term is focusing on 5 missions, reducing the burden on clinician and staff so they can focus on patients, giving people the tools to access information and service directly. Having said that, when you are, as a patient, you are at home, you can access your file, you can access your results, you can access everything, your prescription, your medication, while still at home. And at the same time, if you live in, say, in London and you move to another place, you don't take your medical file with you. The medical file will move automatically to the new GP you are seeing in the new destination. And this hopefully will improve the safety of the patient and improving the NHS, which is, as I said, equals Ministry of Health, improve the productivity. Data saves lives. Without data and statistics, we will not be able to save lives. With AI, using AI in medicine, you can personalize the treatment, and you can tailor the DNA of the patient to enhance immunity. And to enhance immunity means you can fight infection, you can fight cancer, and hopefully we will live longer, and we can turn back the clock on the human mortality, i.e., we're living longer. But nor is this just about longer life, it is about healthier lives as we get older. So to live longer by itself is not something you should look forward to it. To live healthier is more important. AI could be used in all disciplines of medicine, not just perioperative medicine. But because I am cardiac anesthetist and intensivist, I'm just briefly talking about the perioperative medicine because surgery accounts for a large part of hospital care and cost. It generates a large number of data and information. So AI has high potential to be of value in this field. And this, in the field of perioperative care, this will involve surgery, anesthesia, operating room, organization of the hospital, and nursing practice. In anesthesia, you can use it in many ways, but the fascinating thing that to improve ultrasound imaging to the extent that you can probably insert lines and do things easily, and it is very, very useful in chronic pain that you can reach where you can inject your local anesthetics without almost thinking, to the extent that it can be used by non-expert. The good thing about AI in anesthesia also, it can predict hypotension. There is something called hypotension prediction index. And this, if you use it, it can help in reducing occurrence, duration, and severity of intraoperative hypotension. AI is useful also in predicting and evaluation the airway, so you will not be embarrassed as an anesthetist when you find it difficult to intubate the patient in theater. Is it possible for AI technology to replace an anesthesiologist in the near future? It is a possibility, but very remote. In surgery, AI benefit. In surgery, AI will be very, very useful especially nowadays we are using more robot, and it helps in assessing the surgical skills. And for the hospitals and organization, AI is very useful in clinical care. It can predict and improve hospital logistics, like predicting surgery duration and surgeries with high risk of cancellation. Improving efficiency and scheduling will result in cost savings. You can use AI in nurses, for nurses also, in spite of the fact that most of AI applications is aimed or are aimed at the physicians, but AI is potentially equally of benefit for nurses. As I said, nurses are the extension of the physicians, and without them, we cannot function. And they produce a high data, number of data with a lot of documentation, and AI will be helpful with this. So is AI is unlikely to replace the multifaceted role of nurses. We saw that earlier that AI can, there is a potential of replacing anesthetists and maybe surgeons, but it is unlikely to replace the nurses. Just to give you an idea about the progress in computers and how it is progressing rapidly at the speed of light. The human hair is about 70 to 90 nanometers in diameter, the human hair. Advanced microchip is just 3 nanometers. So from 70,000 to 3 nanometers, which is the hair diameter, to a microchip that is just 3 nanometers. At this size, electrons start to interfere with one another. It will be a chaos if you put them together. But connecting larger chips, super chips, we get supercomputer. And this supercomputer will lead to increase in AI. This is a picture to show that the difference between the outer circle. This it shows you the diameter of human hair, and at the bottom here, this is a microchip. It's just the thickness is 2 micron. It's like bacteria. It's smaller than the red cell in our body because the red cell is 8 micron. So microchips, they are getting more sophisticated and faster and hyper efficient. And one company in the States called NVIDIA, they are specialized in making these hyper efficient microchips. To give you an idea about the value of this company, the value of this company is $3.3 trillion. If you put the GDP of Saudi Arabia, Qatar, and United Arab Emirates together, this company is more expensive than the three countries together. And this is because they managed to produce a microchip very small and 4,400% faster than the current or the previous microchips that we know. If you are interested in investing, which I don't advise, if you invest just $50 in this company 10 years ago, you will get it after 10 years as 500. But we shouldn't worry because AI will never replace humans. AI lags behind human brains. The human brain is the most sophisticated organs in the universe. We have trillions of connections and billions of neurons in our brains. Our brains, they are the feeder of these computers. Without our brains, computers will not function. So we are still, hopefully, we will stay in control and we will not be in, will not go through films like scientific fiction films that a robot can control us. So I hope by talking about these two topics, which is just scratching the surface of them, they are more. You can go deep and deep and deep in them and apply whatever necessary in your organization. But this talk is just to motivate people and encourage you to look further into these two topics. Thank you.
Thank you, Dr. Amin, for this fantastic and updated knowledge about AI. And actually, we are interested by all these updates. And actually, in our assisted department here, we are using the ultrasound machine on our practice, even in insertion of all lines and even in blocks. And this put us in a program of RAS in enhanced recovery after cardiac anesthesia for all our patients, especially adults who are sitting the program now. And because of using the ultrasound in regional block, and this make our affecting our outcome regarding the cost and early recovery, and especially in the ICU beds and all this pattern. Plus, we are also going for congenital, but we didn't still set it the full team. I mean the ICU and all the program still not set it. But we have a good experience in the even in the failed cases, and SDV it's a routine recovered before. So we even are in the now in the also we have a program for GIT for advanced GIT program with Dr. Karim Abul Majd. He's also the head of GIT Cleveland, and we are using the advanced program also with him. He is coming to us in a session or the missions every 2 months, something like that. We try to do to be updated, but you know the issue is relying on the donor and the cost, and all this make little bit the progress still a little bit. It's not so much, but anyway, we are in on the runway, inshallah.
I think you, as a hospital, I am fascinated with your website and what you are doing and what you have achieved. And I think you stand a good chance of progressing even further and make the most of what you have. And as I said before, I am very happy that the patients, they don't pay for the service you are providing. I am advocate or I like to see patients having their care, their medical care for free. It helps the doctors and it helps the patient. So you are in the right direction, and hopefully you will carry on the path of, of providing this good service for the patient.
احنا سعداء بحضرتك دكتور امين، ونتمنى يعني ان نلقى حضرتك بقى فيزيكال ان شاء الله في مصر في وقت قريب، وتنورنا ان شاء الله في المستشفى.
إن شاء الله. Planning to come to Egypt November, December, and hopefully I will be able to come and see you. I like, as I said, I am fascinated with your hospital. I like it. To me, it's something that should be achieved in every city in Egypt. The patients should be able to access their medical for free. Here in the UK, we don't pay for our medical care. And yeah,
Yeah, no,
and and with the help of technologies, patient could live in London and then move to another city, and the medical file will move automatically via computers to the GP in the other city where he is residing. So all for free, you don't pay anything. Even if you are old man like me, you get your medication. So you get your you see the doctors for free, whether it's consultant or not consultant. For the pharmacy, you don't pay for your medication. So you don't buy your drugs, you don't buy your medicine. You go to the pharmacy with the prescription, and they dispense you with the drugs, with the medicine without paying a penny. So I wish we could do the same in the UK and benefit the population. It's the most important things for a country is the free education and free medical care. If you can achieve these two, you can have a healthier and prosperous society.
اكيد كلام مظبوط.
We have here Dr. Magawi is the head of electrophysiological team of cardiology, and he wants to thank you. Welcome you.
Welcome, Dr. Amin. I hope this is one of many lectures to come, inshallah. And like your great addition to our continuous medical education program. Really great for the two lectures. We already have started زي ما دكتور أكرم دكتور so we can we've already started on the other congenital heart disease program. We are progressing and we have a dedicated team for it. And hopefully when حضرتك تيجي your input would be greatly appreciated. Also regarding the artificial intelligence, we are also we have our research department who's communicating with other hospitals and other research institutes, including the Nile University in Cairo and the Department of Cardiology, Department of Engineering in Faculty of Information Technology in Cairo University. And they are developing some algorithms, artificial intelligence algorithms related to ECG recognition and also related to some of patients' feedback. So both ideas are quite important, and thank you for directing our attention to them. And we would like you to come and see what progress we're doing in both points of your lecture. We can greatly appreciate your presence. وحضرتك you're always welcome aboard whenever حضرتك تيجي إن شاء الله. It would be great to have you. And one point also that we also pride في مستشفى الناس is that it's not only about having free health service, as you've mentioned, but also with an adequate quality. So we have great anesthetists who give us excellent quality. We have our nurses who follow specific quality control measures. We are one of the earliest Egyptian hospitals to acquire all the quality qualifications that are needed from the Egyptian and from the international bodies. And this is, so it's not only about having free service, but also free service with with an edge of quality. Thank you very much.
I mean, providing service like what you are giving to your patients is something very much appreciated by everybody. But at the same time, as a hospital, you should be accredited by bodies, whether in Egypt or abroad, because accreditation,
Yes.
they put, it doesn't hinder you. Accreditation means to raise the standard.
Yes. So we are accredited by the Gahar, which is the Egyptian equivalence of the quality insurance of in Saudi. I think it's a similar quality program. Yeah, and we are also accredited from what else? A few departments who are working. The JCE also, the JCE. So we have our accreditations. Some of them already done, and some are ongoing. But
yeah, accreditation is very, very important for your hospital to be known and to raise the standard. And at the same time, I cannot stress more about the research and publication, because if you publicize, you are known.
absolutely.
While if being known would be very, very helpful for your place, for your hospital. And I think I'm sorry, it doesn't mean anything to you, but I am very, very happy to see a hospital like yours in Egypt. Because most of the hospital, I graduated from Alexandria, that was many years back before you were born. And I don't know the situation, but seeing a hospital like yours, it makes me very, very happy. And it makes me waiting eagerly to come and see you. لا والله يعني whatever you say, I am very pleased and very happy to see you. And sorry, I these two topics, I cannot go deeper than this because they are very difficult topics, and they have many ramifications. And you can talk about the service of adult cardiologists and artificial intelligence for hours, and you are just touching the skin. You are just scratching a very small area of skin of these two topics. They are very difficult. They are very deep and very extensive topics. And I am very glad. And sorry if I didn't give you the proper picture about these two topics.
دكتور حضرتك جدا دكتور امين ويعني thank you very much.
Thank you.
I am the one who should thank you to give me the opportunity to talk to you guys. And I cannot express, I am over the moon. I am really happy to talk to you. and hopefully we'll repeat it again and again.
Thank you, فندم. You إن شاء الله.
إن شاء الله.
شكرا.
مع السلامة.